Low-level ketosis is also just a normal part of pregnancy. Compared to non-pregnant women, healthy pregnant women have blood ketone levels threefold higher in the morning. And also pregnant women tend to have a marked elevation in ketones when they've not eaten for 12 to 18 hours. Then when you get into late pregnancy, we find ketosis is even more frequent. So why? Why does the body keep pushing to ketosis? First of all, there are changes in pregnancy metabolism that push this state. So in early pregnancy, your body's in an anabolic state. Insulin resistance tends to go down. It is programmed to be this way to help build maternal fat stores, so you have energy to pull from in late pregnancy in the case that you're not getting enough food. Also, aside from nausea and food aversions, you're less prone to ketosis early on. In late pregnancy, your body switches to a catabolic state. It starts wanting to break down maternal fat stores to shunt nutrients and fatty acids to the baby. Insulin resistance is higher, and you're more prone to ketosis. So this is just what physiologically happens in pregnancy. Now, there are theories for why ketone levels go up in late pregnancy. One possibility is brain development. So the fetal brain gets about 30% of its energy from ketones. Ketones are used to synthesize essential cerebral lipids as well. And they also tend to be maintained at higher levels in the placenta and fetal circulation than maternal circulation. And there is some thought that the placenta is actually able to produce its own ketones, and maybe babies are able to produce their own ketones as well. So it wouldn't make sense that ketones would harm brain development if like a third of the fetal brain energy needs are preferred to come from ketones anyways. Just want to throw that out there. Another theory as to why ketone levels may be higher is to provide sufficient energy. So we know that heart and skeletal muscle are more insulin resistant during late pregnancy, or in other words, they're more reliant on fat and ketones for fuel. For example, here's a quote from a research study that showed the generation of ATP in late pregnancy comes almost exclusively from burning fats. Another theory for higher ketone levels is infant survival. We know that placentas of healthy pregnant women have ketone levels at term that are actually quite high, about 20 to 30 times higher than normal blood ketone levels, which is consistent with nutritional ketosis. We know that newborns rely on ketones as fuel until lactose-rich breast milk comes in. In other words, they're primed to be fat burners, not sugar burners. And healthy infants who are exclusively breastfed tend to stay in ketosis for at least the first month of life. I don't know studies that are looking at time periods beyond that, but babies can burn ketones. So if infants are able to burn ketones, why would we think that the fetal baby, the not yet born baby, would not be able to use ketones? Like, just think about it from a physiologic perspective. It doesn't make sense that something would switch right at delivery where they suddenly like to have ketones, but having ketones during pregnancy would harm their brain development. Just think about that for a minute.